is my baby.
I'm Dana Denhoff.
And I am Melissa Bondi, and this is Adventure in Parenthood, where we take a ride on the roller coaster that we call parenting.
Raising kids is one of the hardest jobs people can have. Children all have different personalities, fears, hobbies, or even medical needs. I don't know a lot of Bryn's medical needs, but I do remember when she was young, and I think we've talked about this before, that she had an allergy to eggs, and that definitely made an effect on you and the way you could feed her, and you would have to go to doctor's appointments and run tests and stuff. And I'm sure
Yeah,
it was scary at the time.
it was very scary, mostly scary because, first off, you find out your child has something you didn't know they have in a pretty abrupt way. And this was, obviously food. And then it goes through your mind as okay, now you know that things are going to change. Things have just changed, and now you're going to adapt. And the scary part too was the severity. We didn't know what the severity was. Fortunately, it was not like one of a peanut allergy or something that was, not we were not able to control. We could, but it's still any food allergy definitely changes your outlook on someone's health, and then on how you're going to move forward, and knowing that there's going to be changes made within your family, to your family, and what the severity is. But like I said, fortunately, she's grown out of it, so we were fortunate like that.
Oh, yeah. I mean, really, when you have kids, you don't know, you're pregnant, you have no idea what could happen to your kid at any
Mhm.
point in their life, from the time that they're born to the time that hopefully we die before them. But everything does worry you. Like right now, Corby's 15 months old,
Mhm.
and we just took him to his 15-month appointment,
Mhm.
and he does not walk yet. I mean, he can walk around
Mm.
things. He will
Mm.
hold on to things and walk. But I just saw a stat that 90% of 15-month-olds can walk already.
Mm.
So I'm like, I'm not worried about him, but at
You're
the
still
same token, there's like a little bit of worry. I think he can
sure.
do it. I know he can do it. It's just that if he doesn't walk fully by 18 months,
Okay.
it's like he's going to physical therapy for walking.
Ah.
That's just how it is. And
Okay.
I mean, honestly, it's not even that big of a deal. And I know he can do it. Like I said, he's the
Mhm.
baby of the family. So everyone carries him around more. So that's probably
Mm.
part of the reason he's not fully walking. But everything worries you a little bit as a
Yeah.
parent. Like you can't help but feel like, you see another kid that's like his age and you're like, well, they're walking around, they talk more than
Right.
he does. But that's the problem. You don't want to compare your kids to other people's kids because every kid develops at a different rate. And you don't want to feel like, oh, my
Right.
kid's not doing this because your kid might be doing something that the other children aren't doing. But I feel like personally, you and I are lucky that the things that we've been dealt so far as parents are mild, where
Mhm.
our next guests have dealt with something a lot more serious that is going to change, that changes the rest of the life of them as a family, but as the child, for the child as they grow. For those of us who have felt that burning desire to raise children, know that kids can be a mystery and the future can be unpredictable. We've all dealt with medical issues in our own lives, but a sickly child can leave you feeling helpless. Joining us is Dr. Ziobro, Neurology and Pediatrics with Michigan Medicine, Anne Meskis, Executive Director of the Dravet Syndrome Foundation, and Dana Wright, a parent of a daughter with Dravet syndrome. Welcome to the show, everybody.
Hello.
Thank you for
Welcome.
having us.
Well, let's just start off. I've never heard of this before. I didn't even know how to pronounce it until just a couple minutes ago. So, can you tell us what Dravet syndrome is?
Absolutely. So Dravet syndrome is a severe, lifelong developmental and epileptic encephalopathy syndrome. So it generally presents in the first year of life with convulsive seizures, and the seizures can be prolonged and they can be really difficult to treat with medications. As part of the whole developmental and epileptic encephalopathy syndrome, that means that it involves more than just seizures. So in addition to seizures, patients can have other comorbidities, including things like developmental delays. They can have movement and balance disorders, speech problems, sleep disorders, etc.
So how rare is this syndrome?
Yeah, Dravet syndrome is relatively rare. It is considered a rare disease. So it affects about 1 in every 15,000 infants. And even though it is a rare disease, it's actually our most common form of genetic epilepsy.
Okay.
Really? So we actually have Marianne and Dana here. Marianne runs the foundation, and you also have a child with it too?
I do, and you might see him a little bit in my background. He is now 24 years old and was diagnosed at the age of 4.
Oh, so he was a little older than the regular diagnosis typically is as well.
The age, yeah.
I think we've been fortunate, at least now more recently, because genetic testing is available and it's available at a lower cost, often free. And so our patients are getting diagnosed earlier.
How did you get involved with running the foundation?
So, when Elliot was diagnosed, it was also kind of at the beginning of the internet. And so I was fortunate to find a small little Yahoo support group, and I connected with other parents, and a group of us finally came together in 2009 and said we wanted to do something. I think having a loved one with Dravet syndrome can be really frustrating, and excuse me, you feel like you have no control because there were not a lot of treatment options. There was really no consensus of care. And so we really came together and said, let's just try to raise a little bit of money for research. And then we also, of course, wanted to connect and support our patient families. So that started back in 2009. And then I think as other families were diagnosed, they were also excited to be able to do something that could help move the field forward. And so we've continued to grow from there.
I'm sure it really is helpful to have sort of that community of support and then people that are looking or hoping to get a cure so you can raise money for, because it is hard. When something's rare, people don't have a tendency to put their money towards it to help it.
All right.
Yeah, I think it's really hard. And I think sometimes we have families that come to the organization and they just assume that somebody else is taking care of this, that either a government entity is funding it or that there's been a lot of research done. And while we've been fortunate to see a lot of great strides in the last 2 decades, a lot of that has really been driven by the patient community kind of raising their hand and saying, what can we do to help to either fund research or to participate in clinical trials?
Dana, why don't you tell us a little bit about your story and how your daughter was diagnosed?
Sure. My daughter Ella was born in 2009, which is when the Dravet Foundation was founded. She was developing relatively typical. She was very curious, and she was starting to kind of say her first words. And I would say in April of 2010 was her first major seizure. We had no idea. We'd never seen a seizure before, but it was about 2 hours long, which I've heard is pretty typical, in the first couple months of onset. So the doctors pretty much told us that it was just a febrile seizure. She would probably never have it again, but she kept having them. And it required many, many calls to the EMS for rescue. And it wasn't until about 2013 that she was officially diagnosed with Dravet syndrome through genetic testing, which opened up our world to the Dravet Foundation. So it was wonderful. The organization that Marianne helped build has helped us immensely.
Amazing. Can you talk, Dr. Julie, about the genetic testing and how that really does make a big impact on being able to diagnose someone with Dravet?
Absolutely. Yeah. So it sounds like Ella sort of read the textbook as far as the Dravet syndrome presentation. So diagnosis for Dravet syndrome really starts with a kind of high clinical suspicion. So in patients who have onset of seizures usually before 15 months of age, and then they often will have these very prolonged febrile seizures, there should be a high clinical suspicion that we should do genetic testing. About 90% of patients with Dravet syndrome will have testing that's positive for a change in a gene called SCN1A. And SCN1A codes for sodium channels in the brain, which are actually really important for regulating how the cells fire and talk with one another. Importantly, I always like to point out that the most of the time, the gene change is not something inherited from a parent. It's not something a parent had. It's not something a parent gave to the child, nor is it something that a parent did during pregnancy or development. It's just a random chance, spontaneous change that happened in the patient alone.
Mhm.
That's good to know, because I feel like a lot of times when you do have a genetic, like a faulty gene, you worry about having more children, because I think a lot of times parents do put the blame on their own shoulders. I'm sure Marianne and Dana can talk about that a little bit more, about feeling like they were at fault, but it wasn't anybody's fault.
I did have a visit with an emergency room situation where Ella was having a prolonged seizure, and I was maybe about 6 or 7 months pregnant. So I was far enough along for people to see that I was pregnant. And there was a doctor that said, "Did you know about this before you got pregnant?"
Mm.
And I said, "Why does it matter?" It's you know, like when you become a parent, you get what you get and you take care of it. You take care of your child. It doesn't matter what they end up with. You know, they could be typical, they could be atypical, doesn't matter.
I actually just had a conversation with someone regarding genetic testing, and it was, why doesn't so and so do that or try it, or they've got some family health issues that are clearly present. I guess my question would be, I don't know if you're the right person to ask, but is that encouraged when for families to do when their children are young, just because we're not predicting the future, you can't see the future, but just to have an idea as far as genetic testing and making it more common.
Yeah, absolutely. As our genetic testing is getting better, the part of the issue though is you really need to know what your question is, right? So when you have a patient who has early onset of epilepsy, our chance of getting of finding a genetic diagnosis is much higher than in patients who are older. But our genetic testing is getting better all the time. So if there is something that seems to either run in the family, or if you have a child with a severe disease, especially with an onset at an early age, I think it is important to talk with a geneticist and a genetic counselor to try and figure out if there was a genetic cause for their syndrome or their illness. And then also if there's, if that has implications for further family planning, if it has implications for anyone else in the future. And this is still a very whole new world of figuring out how our genetic testing is working and what we should be screening for and what maybe we don't really want to know until someone's older. So geneticists and genetic counselors are the best people to talk with about these things.
Okay.
I think another important thing to know is that a lot of these individuals with Dravet syndrome are on typically more than one medication to control seizures. For example, my daughter Ella is on 3 medications and the ketogenic diet. We had to just recently add a 3rd medication because she was having difficulties controlling her seizures. But the ketogenic diet tends to be recommended early on, and it's relative. I can't speak for anyone else, but it was relatively effective for Ella early on.
It's a really great point that the reason genetic testing and an early diagnosis of Dravet syndrome is so important is because there are actually some anti-seizure medications that can make seizures worse in Dravet syndrome. So it's very important to have that diagnosis and have it early if there's a high degree of suspicion, because it helps to tailor treatment so that we can really try and maximize outcomes. And I think you make another important point that even, our treatment for Dravet syndrome at this point is very much symptom control. So we try to control the symptoms, which is seizures, but there are other symptoms involved in Dravet syndrome, including the learning and developmental disorders, sleep problems, gait problems. So we try to tailor all of our treatments to the individual and what they need.
And that was one of my questions, Dana, was I had asked you prior to is if your daughter was verbal. I didn't know. I wasn't sure if she acted, was acted like her sister, just or she had those type of developmental delays, and if she could, she was verbal. I was unsure.
Yes, Ella is relatively high functioning. She on the surface seems very typical. It's when you start to get to more abstract conversations, like using the use of sarcasm or certain jokes, they just can't grasp it. And I'm a very sarcastic person, so I have to be kind of careful how I speak with my daughter. There's other types of obsessive behaviors like OCD that can come along with Dravet syndrome. These are the things that kind of make it pretty obvious that she's not a typical child. And this goes along with her academic, her social delays. She, for example, in school has OT, PT, speech, and social enrichment, I guess. She also gets counseling. So they try to teach her how to interact with her friends, how to take in information, and how to understand social cues.
Marianne, I'd still like to talk to you a little bit first, because we didn't get a chance to talk much yet. So talk about, what you've seen and how the foundation has helped people and will continue to help people, and why this is like a great resource for people and families dealing with Dravet.
Yeah, I think anytime you're dealing with a rare disease, and Dravet certainly meets that criteria because we have an incidence rate of 1 in 15,700. It's really hard to get the information you need or make sure you're getting appropriate care. And so when we started the foundation, we really tried to be a convener, and that was not just to help support research, but also to bring together all of the stakeholders in our community. So we wanted our parents to have a place where they could come and find support and resources. We wanted our researchers, of course, to come to discuss what research they wanted to fund and to help fund it. And we wanted our clinicians there who could really help us develop these guidelines for comprehensive care. And so, that I think that having that ecosystem has really helped bring our community together and start to move some of these research questions and problems forward.
And Marianne, this is a national organization, correct? So, because we're talking to you out of state right now, but folks can definitely use you as a research wherever they live. Is that correct?
Correct. And we do have some families from abroad. In some of the other countries, there might be other organizations similar to ours on different levels of scale, but anyone is more than welcome to come to our website to learn more.
Dr. Ziobro, I assume that you work with more patients than just patients with Dravet, because it is like you probably have a smaller number of patients with that. How did you get to the point where you were had patients with Dravet? What is your background like that would accompany that?
Sure. So I'm a pediatric epileptologist. So it means I have expertise in pediatric neurology, and then I kind of took that a step further and studied epilepsy. So that's my specialty. And I have a specific interest in genetic epilepsies. So I research genetic epilepsies in the lab. And I really think that we're on kind of the forefront of bringing much better treatments to patients with genetic epilepsies. And a lot of this has really come about because of family groups like the Dravet Syndrome Foundation and the support they've led in the research realm. So I find it fascinating, and I'm very excited for the future for patients with Dravet syndrome as well.
Where are we at currently with, the research and just, being able to help people with the syndrome so they're not dealing as much with seizures or the side effects of the syndrome?
Yeah, that's a great question. So I think there's a few aspects for treating Dravet syndrome. Like we talked about, our treatments right now are mostly symptom control. And a lot of it is just trying to get comprehensive care for patients, making sure that we're really involving all aspects of their life and their development, that we're trying to maximize their outcomes as much as possible. From a seizure medication standpoint, there have been several new medications approved in the last 10 years that are really specific for Dravet syndrome. And bringing those to the FDA, a lot of the effort has been, again, in partnership with the Dravet Syndrome Foundation to really push those forward to offer more medications that may be effective specifically for Dravet syndrome. And then I think what everyone's very excited is more of these gene-directed therapies. So therapies that are actually going to change the way that SCN1A gene either is expressed, like how much of the SCN1A gene is present, or how it makes more protein, or how it changes the amount of protein that's made. And we hope that this is going to to really open up the doors for patients with Dravet syndrome to kind of correct things more at a gene level. But this is still very new and very much in the research phase. So it's moving fast though. So we expect to see more things in the next few years.
Marianne, you said your son was diagnosed in the early 2000s. What changes have you seen? And is it different to raise an adult with Dravet as opposed to Dana's daughter's, what, 10 or so?
Yeah, I think there's challenges for us at every age. I think, early on, you're worried about controlling seizures, but then as the patients get older, you start dealing with these other health comorbidities. And I think for me, what's been exciting to see over the last 2 decades is, literally when Elliot was diagnosed and I went to Google Dravet syndrome, there were only 3 hits. And so there was very, very little information out there, as you can imagine. And so since then, with community support and our wonderful clinicians, we've been able to put together a consensus of care. And so as Dana had mentioned, our patients take multiple drugs, and there's not a set grouping of drugs that works for every patient, but at least this offers guidelines for families to help them make those decisions. And there's recognition of trying to have early intervention for some of these comorbidities. So all of that is exciting for me. And then, of course, I think the most exciting is the potential for these disease reversing drugs. That was not something I could have even imagined 20 years ago when my son was diagnosed, that there would be that potential in such a short period of time.
It's actually crazy for me to think about that you were like basically alone. When your son got diagnosed, you were basically alone. And that wasn't even that long ago, honestly.
No, I honestly don't know how parents did it before the internet, because that's really what's connected and made our community strong, since we're all spread out so far.
Talk about the importance of having that family network and having people that understand.
We had several years ago, we call it the DSF Family Network, because we wanted to set up different opportunities for those parents to connect. Because I think one of the biggest things we hear from our patient community is that feeling of isolation. You get this diagnosis, there's a lot of unique seizure triggers and a lot of different medical treatments that people are just not familiar with that you are using for your child. And so having someone else who's walked that journey before that you can ask questions of, or who can ask questions of you, is so vital. So that network really brought together the opportunity of having online support groups and virtual chats and workshops and just a variety of ways that families can participate depending where their child is at that point. They don't necessarily have to physically go to a location. There's always another alternative. So we try to make it as easy as possible for our families to connect.
Dana, how has that family network helped you and Ella and your whole family? Because this does affect the whole family. It's not just the patient and one parent, it's everybody.
Right. I think so. Having a wonderful online support group definitely is helpful. I've met some great people that I still connect with in person in my area. That I have at least 3 mothers in New York that are like, if we don't see each other every couple months, every time we do get to see each other, it's like we just pick up where we left off, but we share that connection. And then at home, I'm very fortunate to have a partner who's like he's involved with raising our daughters and everything. My youngest daughter I feel like it's changed her or shaped her in a good way. Like, she's very empathetic. She's still a typical little sister, but she has an understanding that most younger siblings will never have. And when it comes to the grandparents and the aunts and uncles, it was a little bit of a challenge to have them fully grasp the gravity of our situation. But once they did, everybody's involved, everybody understands, and they'll make space, if we have to cancel plans or something. But yeah, it was definitely a journey to get to where we are right now. And we're continuing on. So it's not going to end for us.
Dr. Ziobro, talk about the importance of patients having the ability to go to these comprehensive care centers and how that is helpful for them in the long run.
Yeah, I think the most important thing for patients is to have comprehensive care. So they may not have a a center that has the designation, but understanding that they have multiple comorbidities associated with Dravet syndrome. So it's really important that they have a pediatric epileptologist who is at least somewhat experienced with Dravet syndrome and knows some of the best practice guidelines about which medications to avoid, which medications to use, and then kind of how to potentially use them in combination and tailor it to the individual patient. I think is one of the most important things for patients with Dravet syndrome, but then also involving the other aspects of care, including the developmental therapies, physical therapy, occupational therapy, developmental and behavioral therapies, and however that may be necessary for each individual. So even though they may share the same gene changes, patients with the Dravet syndrome can be very, very different from one another. And it really is very important to treat the individual and meet them where they are so that we can try and maximize their quality of life by reducing seizures and the most other developmental, their developmental progression.
What's the type of doctor that your son sees because he's an adult?
So
for his
yeah, we just made the transition from pediatric to adult neurologist, but there is a lot of difficulty right now for a lot of our patients who are in that age group, because since we are a newer recognized disease, there's not a lot necessarily taught during neurology training around Dravet or other developmental and epileptic encephalopathies. And so a lot of our patients end up staying with their pediatric providers, even when their child is in their 20s or their 30s.
Okay.
Well, we're actually almost out of time, but before we go, can we talk about your hopes for the for research in the future and why people should support the Dravet Foundation?
Based on our conversation today, I'm even more hopeful than I ever was because, you know, I'm only aware of one medication that's Dravet specific, but it's nice to know that it's coming, that more is coming. And also, it's also great to see where the funding is leading us. So thank you, Mary Ann and Dr. Ziobro for your help.
I mean, I think it's a community effort, right? And, you know, for us as a foundation, we've been able to award a little over $9.1 million in research grants, and that's barely scratching the surface. But what it is helping to do is build this, you know, system of researchers and clinicians who are working together to start thinking about other ways to approach this disease. And so everyone on our board, our staff, our volunteers are really personally invested in the organization. So we really take our fiscal responsibility and transparency very seriously. We're trying to do the most we can, you know, with the money that we have. And we're always appreciative of those who are outside of the community that are willing to come in and perhaps make a donation and help us solve this issue.
Well, I want to thank you all for being on the show and teaching us about something that I had no idea about. And I think it's important to highlight things like this so we do know what's happening out there with different people, even if it is rare. It's affecting many people still.
Thank you for having me.
If you have an idea for a parenting show topic or guest, talk to us on social media at #CTN Ann Arbor.
And for more on our programming and our services, visit a2gov.org/CTN and visit youtube.com/CTN Ann Arbor to watch a full lineup. And remember to like, to subscribe, and to share. And thank you for joining us on this adventure in parenthood.